Good evening, everyone. If your child gets sick at school, who do you expect to be there for them? Well, likely it's a school nurse.
But as kids go safely back to school, they may not have a nurse there to care for them. News Channel 5's Kelsey Gibbs tells us how this pandemic is adding more work to an already stretched thin workforce.
Prior to this pandemic, we had a deficit of school nurses.
Janet Thornton, who sits on the board for the National Association of School Nurses and represents Tennessee, says there's always been a school nurse shortage.
We currently average in the southeastern part of the country about 60% full-time school nurses.
Thornton says many nurses are assigned to more than one school.
So there's many things going on that these school nurses are responsible for, and there's only so many hours in the day and only so much one nurse can do.
She says nurses already have to be responsible for their chronically ill student patients, vaccine records, and more. In the middle of a pandemic, though, school nurses will now have a heavier load, keeping up with symptoms of students and staff when it comes to COVID-19.
My concern is we're going to see nurse burnout, some compassion fatigue.
Some school nurses also fear catching the virus and the lack of personal protective equipment.
There is a concern to have enough PPE because those nurses, they've got to don that PPE and go into an isolation room to assess a child that may be symptomatic for COVID and taking that home to their families or maybe an elderly parent.
It's not just school nurses who have concerns. There's the problem of what to do if the school nurse gets sick.
Who comes in for that nurse? Do we have enough substitute nurses to come in and pick up when the school nurse maybe has to be self-quarantined for 14 days?
Kelsey Gibbs, News Channel 5.
Metro Nashville Public Schools has 70 school nurses for 135 schools. A spokesperson says the district is in the process of hiring 8 more.